depression since around 12 years, and what she talks about is that right now she is in a lot of stress. She is working as a HR manager in a company with a lot of work pressure, but still she wants to change the job. And why she wants to change? To grow in career, go for a job which will have much more workload, because she wants to progress in her financial aspect. And when I asked this lady other questions, this is yeah, so then it's a very long case, so I'll be just discussing the main points of the case. So she is mentioning her main presenting complaints are of depression and of gastritis. So this gastric pain in the epigastrium she has after eating since many years, and it also gets aggravated after least spicy food and alcohol, and the depression, which is her main complaint, and many other complaints of sciatica and other pains. So go ahead please. And her the depression main symptoms are panic attacks, and the panic attacks, the characteristic is that whenever she is anxious, she has some anxiety in the chest, and she is better by moving about. She has to pace about, she can't sit. And her aggravation in all the symptoms is in the afternoon, 4 to 4 p.m., 3 to 4 p.m., or in the morning, even the irritation, weakness, and all the regular depression symptoms of weakness of mind and everything. And the main points in the patient's long narration were that my family has been very unfair to me. She was like that the situation in the family was that her brother's wife took a divorce, and so now she had to take care of the brother's child, and she felt that my career growth is hampered. The family expects me to do everything for the child, and she said that it's as if all out there to exploit me. सब लोग चाहते हैं कि इससे जो करवाना है, जितना काम निकलवाना है निकलवा लो. Go ahead. And she also said that everybody is as if discriminating against me. The brother is given all importance. I had observed that she had a very cold relation with her mother, and she herself said that I have a very love-hate relationship with my mother and my brother. Though my mother has done a lot for us, the father was an alcoholic, so the mother had brought both of them, the brother and her, up. But she said that now it's as if they all just want to use me, they just want to exploit me, and nobody is thinking about me. I think about everybody in the family, but nobody thinks about me, about my career growth. And yeah, please go ahead. And also she says that I want to work, and I feel that they are all trying to control and interfere with my career growth, and I can't show my back towards family. At the same time, I cannot allow them to exploit me. Go ahead. So this was the main. So when I asked about her experience, so it was like she felt exploited, used, stuck. I'm stuck in this situation. But on probing further, the stuck was like, okay, I'm stuck that whether I should do something that I want for my career growth, or should I do the responsibility that my family wants. So this was the stuck. Stuck was the internal conflict between doing for the family or doing for her own personal interests. And she was wanting to make more and more money for financial security, and she talked about I'm lagging behind, everybody is going ahead. Please go ahead. So these were her main things, and her fears were of falling, of water, of drowning, of not having financial security. She was very conscious about the looks, acne also she complained about. She wanted to have a good reputation, and he talks about being a very people pleaser. She says, I don't know what is it that internally compels me to please everyone else. And even though her gastric complaints get aggravated, even her sciatica gets aggravated by alcohol, but because in a peer pressure, in the work culture, she has to take alcohol. So she has to be a part of the group. That was very clear in the case. And the dreams are of the family, whether in a peaceful situation, her bhabhi coming back and everything good, or a lot of fights in the family, both the things she had. And the experience in the dream was of stability, security. That is what came ahead. So go ahead. So then when I assessed this case, also because it's a depression case, even I assessed it according to the PHQ, the Patient Health Questionnaire, which is a globally accepted criteria for depression diagnosis, assessment, as well as the follow-up criteria. So here the PHQ score was as high as 16, despite she being on antidepressant medicines. Please go ahead. So then this is the PHQ score. So now how do we analyze this case? So in this case I followed the 5-finger approach. So first we did the superclass analysis. In the superclass analysis I could understand that this case was she needed financial security, she wanted stability, so the fourth superclass. Then the kingdom analysis was very clear, I versus you, everybody is trying to discriminate against me. So that was the animal kingdom, and the sub-kingdom analysis was also giving us a clarity about that, a conflict, an inner conflict between pleasing others and my own interest, and being exploited, wanting to belong to a group. So the entire mammal kingdom clarity also we got in this case. Then from the miasmatic approach, nothing was clear. You can go ahead. So nothing clear in the miasmatic approach, and so then we took the symptom approach. So there were many characteristics in the patient, that her gastric burning aggravated by spicy food, acne, then brain fag and anxiety, all the symptoms aggravated around in the morning as well as in the afternoon, fear of drowning, fear of heights, all this thing was there. So then I repertorized the case. In the repertorization chart, took all these symptoms, took all these rubrics. The rubrics which we did not get in the physicals, we took it as a general rubric, and in this way when I repertorized the case, on the mental symptoms, lactoprinum is what came very ahead in the case. Please go ahead. And then I also repertorized all the physicals of the patient, where we got many, in the animals we got, go ahead, lac humanum, lac lupinum, as well as lacan and lac caprinum. So these were the medicines. And then from the Materia Medica, I tried to read from Shekhar sir's mammals lecture, from Gandhi sir's lectures, and also from Patricia Heatherly and from Ian Sholter's schedule. So with the understanding, I understood that this concept of going on the top, she's wanting to go on the top, she doesn't have any need for leadership or anything, but she just, for financial security, she wants to be at the top, and this is a theme of lacaprinum. So I prescribed lacaprinum, as well as this patient had a lot of acidic symptoms when I took the entire case according to aphorism 94 also. What were the exciting and maintaining causes in the diet? I also advised her alkaline diet and some yoga and a good lifestyle. And then based on all this, in the next follow-up, the patient showed good improvement in the mental condition, but I observed that maybe 200 was still on the emotional level. This patient needs a 1M potency, more on the delusion level, so I increased the potency, and the next follow-up was too good. Then we could even reduce her antidepressants, and all her symptoms, the depression, the gastric burning, everything was better. Now she could even tolerate moderate spicy food. Earlier she could not tolerate even little spicy food. So mentally and physically, both planes, she was much better. Please go ahead. And this is her latest follow-up. Just play the recording. Play the audio.
So I had my depression medicines when I came to you, and all these months I kept it inside me. You never know, kya pata. But yeah, I had it in the back of my mind, and I would see it. मैं अलमारी खोलती थी, मैं देखती थी, हाँ ठीक है, पढ़ा है. But then मैं मेरी अलमारी साफ करी थी अभी थोड़े दिन पहले, I looked at it and I felt it. Yeah, I don't need it anymore, and I'll not need them again. ऐसे तो वो courage मेरे को बहुत अच्छा लगा कि मैं वो कर पाई. So I do that. My mom was also very happy. So I just wanted to share that with you.
Stay.
Like honestly, when I came to you and you told me that आपकी depression की दवाइयाँ छूट जाएंगी and ये सब छूट जाएगा, I was thinking it सब थोड़ी होता है, इतने टाइम से मैं ले रही हूँ, ऐसे थोड़ी छूट जाएगा. But I'm so glad that it could happen. So I'm very good.
And what about your older cases?
We can go ahead, but that will be a long.
Medicines when I came to you, and I had my depression medicines when I came to you, and
yes. So here she also goes ahead and she tells about that earlier she had that compulsion to please people at her own cost. She said whether in the office people just take me for granted, they want advice from me, everybody in the office and the home, they exploit me. But now she said, now I feel that I'm not that much compelled to please people. And then we also had her PHQ 9, then I also took the patient health questionnaire 9, and here in the first time, despite her 10 years of antidepressant medications, she had a score as high as 16. In the PHQ-9 score, 10 to 14 is depression diagnosed, confirmed, less than 10 is not a depression, and more than 14 is a major depressive disorder. So despite the medicines, she fell into the category of major depressive disorder, and after our medications, after a follow-up. In fact, this patient, I had to taper down her medicines, but she herself stopped the medicines altogether on her own, and still her PHQ-9 score is 6, which is confirming that now she is no more diagnosed as a case of depression. So I'm very grateful to Shekhar sir, entire SWARA team, for all these teachings, that we can take the patients deeply into all their sensation level, understand the patient holistically from the superclass, from the kingdom, from the subkingdom, from the miasmatic approach, from the symptom approach, and from the repertorization, and give such good results to our patient. Thank you very much for each and every member present here.